She's Dr. Nermeen Mustafa. She's eminent lecturer in Shams University Hospitals, Faculty of Medicine, and she's going to talk about prospective pilot study of trastuzumab, pertuzumab, paclitaxel, carboplatin, Herbitac in treatment of HER2-positive metastatic breast cancer. Here we are.
Thank you so much, Professor Ahmed. Thank you so much. I'm Nermeen Mustafa, lecturer of clinical oncology in Shams University. Prospective pilot study of trastuzumab, pertuzumab, paclitaxel, carboplatin. We gave the name Herbitac, the abbreviation of the drugs which were used in the study in the treatment of HER2-positive metastatic breast cancer. Introduction and objective: breast cancer with positive HER2-neu is an aggressive disease with poor prognosis. The addition of pertuzumab to trastuzumab and docetaxel significantly improves survival in metastatic setting, but an area of investigation is whether other chemotherapies could provide the same efficacy. In this perspective, we aim at evaluating the efficacy and safety of trastuzumab, pertuzumab, paclitaxel, carboplatin combination regimen. Patients and methods: between June 2016 and October 2017 in Alpha Cure Oncology Center, Cairo, Egypt, metastatic breast cancer patients were recruited with the following criteria. The inclusion criteria: histologically proven primary breast carcinoma, woman aged equal or older than 18 years old, performance status ranging from 0 to 2 echo, known HER2 positive status proved pathologically, normal cardiac functions must be documented within 90 days prior to the registration, the results of ejection fraction must be above the normal limit of the institution. The exclusion criteria: we excluded male patients, male breast cancer patients, pregnant or nursing women, pre-existing peripheral neuropathy, grade 2 or more, known allergy, hypersensitivity of prior infusion reaction to one or more of the following therapies incorporated into the treatment protocol, known or suspected congestive heart failure, angina pectoris requiring anti-anginal medications or other clinically significant cardiac conditions. The protocol: the number of the patients were 20 metastatic breast cancer patients. The regimen was trastuzumab in a loading dose, first 6 mg per meter square, then given every 3 weeks, pertuzumab 840 mg and paclitaxel in a dose of 60 mg per meter square weekly, and carboplatin ASC2 weekly, non-stop. They were given 6 cycles with mid-evaluation every 3 cycles, and the patients who achieved partial response or clinical complete response, they were maintained on trastuzumab perjeta every 3 weeks until progression or unacceptable toxicity. The results: the median age of the patients were 40 years old. 12 patients were premenopausal, 60% out of the total number of the patients. The hormonal receptor assessment, the estrogen and progesterone receptor, were positive in 75% and 65% respectively. 14 patients were received previously trastuzumab in the adjuvant setting, and 30% were the first presentations are metastatic and they were de novo for anti-HER2 regimens. The number of metastatic sites varied from 1 to 3 sites, and we excluded the patients with CNS, or we do sub-analysis for subgroup patients who were CNS, have CNS metastasis, which were present in 4% of 4 patients only, 20%. After a median follow-up period of 8 months, ranging from 3 to 18 months, the median progression-free survival was not reached, and 1-year progression-free survival rate was 64%. 7 patients, accounting 35%, achieved complete response radiologically and clinically. 5 patients achieved partial response with overall response rate 60%, in addition to 1 patient remained stable. The clinical benefit rate was 65%. The 2 patients who achieved response continued maintenance trastuzumab, pertuzumab for a median number of 10 cycles. This is the graph illustrating the median progression-free survival of the patients who were on the protocol. Regarding the toxicity was recorded according to the CTC version 4. 1 patient only developed grade 3 neutropenia. 7 patients reported they were tolerable for the protocol. Regarding grade 1 and grade 2 toxicity, 65% developed grade 1 and grade 2 toxicity, including hematological toxicity, representing 10% in the form of neutropenia, 15% representing gastrointestinal toxicity in the form of anorexia and vomiting. Others, fatigue and neuropathy ranging from grade 1 to 2 were accounted in 25% of the patients. To conclude our protocol, that HERP-TAC protocol was effective and comparable response rate with the original protocol, trastuzumab, pertuzumab, docetaxel, with acceptable toxicity. Thanks.
Thank you, Dr. Nermeen. I think we have a couple of minutes for any more questions. Dr. Muhammad. Dr. Omar. Thank you a lot for your presentation, and thank you all for attending this session, and we'll meet you soon. Thank you.
Thank you.